Hi there, and welcome to the Play Therapy Circle. Before we begin, please note this podcast is for informational and educational purposes only. It does not provide therapeutic advice, and listening does not create a client-therapist relationship. All views expressed are my own, and any case examples shared have been de-identified to protect privacy. If you're seeking personal support, please reach out to a qualified mental health professional in your area. Hi, and welcome to an episode of the Play Therapy Circle. I'm Kylie Ellison, a therapist, clinical supervisor, and play therapy trainer, and I'm so grateful you're here. This podcast is a space for thoughtful, soulful conversations about child-centered therapy, play-based work, and what it means to show up with presence and compassion, both for our clients and for ourselves. Whether you're a seasoned play therapist, a student just starting out, or someone deeply passionate about working with children, you belong here. Welcome back to the Play Therapy Circle podcast. I'm your host, Kylie Ellison, and I am so glad you are here. Happy Thursday, everyone. Wherever you are in the world listening to this podcast today, welcome. I told you guys last week I was going to try and make the commitment that I was going to record this during business hours, and I wouldn't be living my tenets of CCPT if I wasn't congruent. So guess what? It's really late at night. I'm recording this. So I think it's a good thing that at least I'm getting it done. So I'm committed to the process, you guys. It's just a little bit later in the evening than I had planned. So welcome to our Play Therapy Circle family. I hope you have had a wonderful week. I am excited, as always, to talk all things child-centered play therapy. And so episode 6 today is tackling that question of the difference between directive and non-directive approaches in play therapy. So as always, I hope that this is useful and helpful to you. I just need to mention I am in a different room today, and I am also sitting next to my dog, Molly, who has joined us tonight. So if you do hear Molly in the background, she also says hi. Okay, so we are going to take a deep dive in to this topic, and I guess I want to really unpack and help us to understand what each of these particular approaches entail, what they look like in practice, and I guess some of those key differences. What I love about the community we are fostering here for all of you following along in our Play Therapy Circle family is that we all appreciate and value and recognize each other's approaches to play therapy. You are all welcome within the circle. So I think that I will be keen to unpack those different approaches, share a bit about what I do, but recognizing that for you listening at home or on your walk or wherever I am reaching your listening ears today, that this is a topic of conversation that honors our own journeys and our own frameworks for practice. So I'm looking forward to sharing all of the components of both directive and non-directive today. So let's dive in. So I think that where I would like to start with this podcast today is starting really from the beginning in terms of those definitions or from those kind of core concepts. I think that's helpful to ground us in understanding, I guess, the difference between both. And I think it's something particularly for beginning play therapists that you might be navigating or seeking to understand a little bit more about in terms of that difference between directive and non-directive play therapy. So when we're talking about directive play therapy, we're referencing or talking about when a therapist takes a more structured role in the playroom. So the therapist might guide sessions with specific activities, games, testing hypotheses, all different ways that they can help a child to practice certain skills or work through particular challenges. There's obviously many examples of this. There might be, just as a kind of scenario I'm just putting out there, it's not based on anything in particular, but potentially you might have a situation where a therapist uses puppets to rehearse coping strategies for anxiety, or a situation that the child might encounter that they want to prepare them for, or providing, say, structured art activities to help with emotional expression and regulation. That is certainly where we see directive play play therapy sitting. In contrast, we have non-directive play therapy, which is sometimes also referred to as child-centered play therapy, which is obviously my area of practice. So we take in child-centered play therapy a slightly different approach where we really have the child leading the way in terms of that agenda and progress and trajectory of work in the playroom. So we provide that environment, the toys, we have our language that we use to help support kids in that space, but we align with the idea or the intention behind the child choosing what they will do and how they will express themselves and work through their issues in the playroom. So we don't provide a direct structure in terms of the play. So both of these approaches are very important in play therapy and our field in Australia and overseas. And so I want to talk a little bit about unpacking, I guess, those distinguishing characteristics or differences there, because I think that might be helpful too. So what do we know about those key differences between directive and non-directive play therapy? So in directive play therapy, one way of conceptualizing that could be that we could say that the therapist is more like a guide or an instructor. So these sessions often follow a plan with specific goals in mind. So there's an intention behind the work that the therapist is doing in that particular session or sessions in a directive space. In the non-directive play therapy space, we can kind of look at the therapist being more that facilitator of that environment and that space for the child to explore, and it has that less structure and opportunity for the child's choice in that space. I think another way that we could look at it in terms of those different characteristics is also unpacking or understanding the definition of goals in terms of directive versus non-directive. So oftentimes, directive work might focus on building skills or reducing symptomology, whereas non-directive play therapy looks at more of a holistic growth, self-expression, the child leading that agenda of those goals. For example, in a directive session, you may have a therapist that might pull out a resource, such as a board game. I mentioned a few before in terms of other resources in the room, with that specific goal, I guess, around helping to build frustration tolerance, expand the window of tolerance as well, helping with those elements of goals that the therapist can assist in the playroom in that connection with the child, versus, I guess, that non-directive session or space where a child might choose resources in the room and engage in some of that symbolic play, say in the sand tray, and the therapist's role is more around reflecting and tracking that work, making meaning of it, of course, as well, but not, I guess, providing that structure or direction to that sand tray work. So that's a little bit in terms of those goal differences and I guess how those sessions might look. I think that what I would love to convey in this reflection of that directive and non-directive space is that both have very useful functions in terms of the work that happens in the playroom and that intervention with children. So when we are looking at that more directive space, directive play therapy certainly has those benefits in being especially useful when there might be, say, a short time frame of intervention with the client, or there is those specific goals that the family and connecting with them have set with the therapist for the child. It can also be reassuring for parents or organizations if they're seeking more of those concrete kind of measurable outcomes that can be obviously reported back then. So that is certainly the benefit of directive play therapy. In non-directive play therapy or child-centered play therapy, as I live in, it offers something different in terms of the child being viewed more having autonomy, I guess, in the room, leading, as I talked about before, the agenda and the goals in the playroom. And by having that facilitated space in that non-directive format, we rely on building that sense of trust and resilience and connection and safety so that children can unpack their world in their own way, in their own pace, rather than having a specific agenda. So I think one of the considerations for practice that I think is really important is to look at, I guess, the context of the sessions and what might be happening challenging in terms of the delivery in certain settings. So whether it's in a school setting or a clinical setting or outreach, what that looks like in terms of suitability for those approaches, and where directive might have a better suitability, I guess, in that space as opposed to non-directive. What I think when we tackle this topic, especially for beginning play therapists in the field, and I guess the message I want to connect with everyone listening at home is more that I think what's important is to have a framework that aligns with your approach to intervention. I think that we can certainly be drawn to different modalities, such as directive or non-directive play therapy. I know there's practitioners out there too that do an integrated approach of both as well. So we have amazing practitioners in our community in Australia who do incredible work in the space of play therapy. And we all have our strengths, our approaches that we're drawn to that sit for us. And so that is where we navigate our play therapy practice. So for me, and I guess every person is different in this space. Every practitioner is different. And I liken that to play therapy as well. I feel like everything at the end of the day relates back to child-centered play therapy or play therapy, directive or non-directive, guys. I can't help myself in integrating this modality into my everyday practice. So I think that when we're talking about that experience or that journey for play therapists, it's not dissimilar to experiences that children have in the playroom, right? Where we can have this exploration at the beginning of our play therapy journey, where we are understanding and getting to know the different modalities out there within our field of play therapy and what aligns and works best for us, what speaks to us and feels most comfortable for us and is something that we gravitate towards in terms of our practice with children. So I think that everyone is going to be different, and I certainly come with my own background and experience and qualifications in the field, where for me child-centered play therapy sits really well. So for those of you who don't know a bit about my background, I don't think I've actually talked about this ever in the podcast, or maybe I did. I don't know. Like I said, guys, it's a little bit late. But I have been working in the human services industry now for over 20 years. Started out in acute mental health and child protection, and then moved into non-government, worked in community services, lots of different agencies before moving into private practice. So I've had a journey, I guess, in terms of many families I've connected with over the last 2 decades, and obviously working specifically as a child-centered play therapist for the last 10 years. And I think that it just, for me, connects well with how I guess I view my role as a therapist and how I view that intervention and connection in the playroom. But that's going to be different for everyone, and that's okay. I think we all have a space and an importance in this field. And so for me, I really like child-centered play therapy in terms of that opportunity for me to sit more in that space of not having the answers or being the expert or wanting to lead. For me personally, that doesn't necessarily sit for me. So I like to offer that space when I connect with children on those principles of CCPT, of them allowing the child, to be able to tell their story in their way, in their time. That is definitely something for me as a CCPT practitioner that I do need to navigate in terms of the things that I spoke about earlier in relation to location of delivery of services. So I've had clients I've seen in outreach, in schools, and now I have obviously my clinic I've had for a while now, but that is a consideration for practice when we're working in that CCPT space. And I guess also to funding restrictions and stakeholder expectations. And there's so many factors that go into the work that we do. And so I think, what I guess I'm keen to share and have you as a listener reflect on yourselves is what resonates for you in that space and what works for you, because ultimately we all have those different training backgrounds, but we have that opportunity to bring our whole self to the playroom as well. So we were talking last week in episode 5 about ultimately at the end of the day, that therapeutic relationship and the foundation of that connection between a therapist and a child is absolutely paramount over any of these kind of approaches that I've talked about today. So we value all of these approaches in being able to connect with kids, but ultimately at its core, we all agree that relationship and connection is super, super important. So I guess certainly when we're looking at some of those considerations in terms of work, when practitioners might lean towards directive or non-directive, what might be part of those factors that are considered when we're applying the different modalities, the different approaches. So looking at certainly context and intention. So if we are looking at certainly very specific behavioral or skill-based needs, directive methods could be very effective in that space and could be something to consider. Whereas if we have a child that needs space to explore their emotions, develop trust, and need it to be at a slower pace, non-directive or CCPT work can be really helpful there as well. So I guess I want to encourage you guys to consider what are your own values and strengths as a practitioner. And I guess thinking about the clients that you're working with, in what context you feel that non-directive or directive might be helpful. And also, I guess, considering that location. So whether you are in a school setting, in a clinic, at home, or in a community, and what might be the ways that you can navigate that, either in directive or non-directive spaces as well. I think ultimately, as I round out this episode and really, I guess, offer that opportunity for your own self-reflection around what I guess I've shared today and what resonates for you, because I think everyone's going to be different about where they lean. And certainly for me, I think that both directive and non-directive have benefits unique to them and considerations for practice as well as key differences. And I think both approaches absolutely have their place in our profession. It's so important to consider our whole community and our whole circle family when we're talking about play therapy. And I think for me personally, in terms of my own philosophy for practice, and I guess it doesn't come as any surprise because this is a podcast about child-centered play therapy, but I certainly lean into that CCPT space 10 years down the line in my play therapy journey, because it really does resonate for me, I guess, in terms of my view of working with kids, and really at its core leaning into that Rogerian way of seeing the importance of that self-actualization principle in the kids that I work with and their capacity for growth. So that is certainly all those things to consider. And the great thing is that we are always learning, right? And I always say that all of the children that I connect with in the playroom are my teachers. So they are always teaching me about my practice and offering that opportunity for self-reflection along the way, which is great. So I would love to hear from you. I'd love to hear your reflections in terms of where you lean, what connects for you. And we'd love to have your feedback. So we post a message on our Play Therapy Circle podcast Instagram page where we let you guys know that the episode has dropped. And so feel free to let us know in the comments what resonated for you in terms of your reflections of this topic when listening to this podcast today. I am so grateful that you are here. And look, this episode only went for 18 minutes this time, guys. So I'm getting much better to staying on time, right? That is a work in progress. What are we going to cover next week? I want to do a bit more of a dive into understanding the child's world through play. And I think that is so important when we are considering those fundamental elements of child-centered play therapy around themes, stages of play, understanding how they communicate to us. What are some of those theories that really influence child-centered play therapy in our assessment and analysis of understanding the child's world? So we've got a lot to talk about next week, you guys. But hey, thank you so much for your support. Genuinely, I am so grateful to everyone that has been listening, has been giving such great feedback. This podcast is intended as an opportunity to share all aspects of child-centered play therapy and how we work and why we love what we do. So we've got so many topics to go, you guys. This is just the beginning. So thank you so much for joining me tonight, because I'm recording this tonight, you guys. So until next time, please take care of yourselves and each other and keep holding space for letting children's stories unfold in the playroom each and every day. I am grateful for each of you. I look forward to talking to you again soon. Thanks. Bye. Thank you so much for being here for another episode of the Play Therapy Circle. If anything resonated with you today, I'd love it if you could follow the podcast, share it with a colleague, or leave a short review. It really helps others find our circle. And if you have a topic or question you'd love me to explore, I'd love to hear from you. This space is for you, and I want it to feel like a conversation. Until next time, take care of yourself, and remember, you belong here.